Following pregnancy and weight loss, patients are often very dissatisfied with the way that their abdomen looks. And this is where a tummy tuck or abdominoplasty is very, very useful in helping to reshape and restore the abdomen to what it used to look like. Now, there are many types of tummy tucks, and depending on the degree of deformity will determine what kind of tummy tuck will be necessary. For example, if a patient is quite thin, doesn't have too much in the way of skin excess, the muscles underlying it seem to be in a reasonably good position, but only really has a little bit of excess tissue just underneath the belly button, then something called a mini tummy tuck is a very, very useful procedure in this case. It can be accompanied by liposuction, which can help shape and contour the flank area so that the silhouette is very aesthetic, but it avoids the slightly more involved procedure of a muscle repair and more widespread liposuction, which can mean that the recovery is a lot shorter and people get back to their normal activities a lot quicker. If a patient comes in and they have, in addition to the excess skin, the muscle underneath seems to be a little bit lax and also more widespread fat, then a full abdominoplasty is required. And what this typically means is, again, making an incision which is very, very low, lifting up the skin, but in this case we have to cut around the belly button and release the skin from above the belly button so that we can stretch it out to its full length. Again, this can be accompanied by liposuction to help improve the contour, and quite often, especially following pregnancy, multiple pregnancies in fact, where the muscles get separated, a muscle repair is often required in this. The recovery is a little bit longer and normally takes about 10 days, but it does achieve a very, very nice result in this subset of patients. A third type of abdominoplasty is something called an extended abdominoplasty, and that's where the excess skin and fat aren't just restricted to the front of the abdomen, they extend round the abdomen. And in this situation, just doing a standard full abdominoplasty would mean that there'd be excessive tissue on either side, something referred to as dog ears. And quite often, if a patient in this situation has a standard abdominoplasty, they still complain of that fullness, which we have to then go back as a second operation to correct. In this situation, the excision is extended around the back, not all the way around the back, but somewhere around the back, and the liposuction is also extended there. The recovery is not particularly longer than a full abdominoplasty, but the scar is a bit longer.